it's Melissa and Frank this week because I put lip balm on that smells and he wants to eat it. And I'm sure Gracie will come by and say hi too. So first I want to say thank you to everybody for subscribing and following and sharing the video. This week, I think I'm doing one that everybody can benefit from. And especially if you go to doctors all the time or have a medical condition, hopefully this benefits you a ton. Sorry, I can't help what angle you're getting. Frankie, can you sit? Okay, so I want to start by saying that I've had a few people reach out to me this week, and I just want to tell you it means so much to me to hear that you're getting something out of these videos. And then, not that I want to hear that you see, this is what happens. Not that I want to hear that you had that it personally affected you, but if it does affect you and you need somebody to talk to, send me a text, send me a note on here, send me a Facebook note, whatever. Don't think I'm too busy. Because this is not a fun journey, and if it affects you or someone you know, and I've talked about something or you're curious about something, just call or send me a note. I really don't mind. Okay, so with that said, I made this sheet 3 years ago that I keep a copy here. Sorry, that's my port. If anybody's wondering what that is, it's my port. It sticks out like a sore thumb. But I keep, we just call it the medical sheet, the sheet. I keep one on our refrigerator on the side, and then I keep one in my purse, and I keep one in each car. And here's why. So a couple years ago, there's been a couple of situations where friends have taken me to the ER, and even though they know this, they know my situation, they know, that I take certain medications. Of course, there's ones that, like, they probably don't remember my IV chemo name. They probably don't remember the pre-meds I get from my chemo. And there's just a lot of things that, I'm lucky I know what they are, but if I was not conscious, there could be some really bad things happen if I got drugs that I wasn't supposed to have, if they cut me open and they're not supposed to. There could just be a lot of problems. And kind of what started this whole thing is I took one of my best friends to the ER, and her husband stayed home with their kids. You know who you are, Toronto. And when we got there, my friend passed out, and the hospital was like, what is she taking? Blah, blah, blah. And I'm like, well, she took, now I'm not going to remember what she took, but at the time she had taken, like, say, Benadryl. However, she had had a procedure a few days before. Come to find out, we found out she was allergic to the anesthetic that they gave her. The problem was, walking into the hospital, they're asking me height, weight, blood type, allergies, all of this stuff about her, which I knew a lot of them, but when they're asking allergies and medications, like, you kind of want to really be sure. So anyway, the sheet, which is actually 2 sheets. It was 3, and I had to shrink stuff, so now I have to wear probably oh no, we're still good. I was afraid I was going to have to wear my readers to see this. Okay, so I have sections. Tailor it to your needs. Put it on a little tiny, if you have, like, say my sister, no issues, but she's A negative blood. Good to know, because I'm O positive. So instead of having to draw blood, they can just see A negative and they're like, done, we know. Tailor it to your needs. So if all you need is just a business card size in your bellfold, put it in there. I need 2 sheets. Other people might have 12. I don't know. So here's all my info. And Frank just ran away, so that means Gracie's gonna come over. So the first section I have are my doctors. So I have everything from their business card. I'm sorry, my glasses are loose and they keep sliding. It's driving me nuts. Everything from my business card has been transcribed over to here. So I have everything from, so let's just say, for instance, my radiation oncologist, who I love and I never talk about because I normally just talk about Dr. Lee. So my radiation oncologist is Dr. Kevin L. Shuey. And then I have Red Rocks Radiation Oncology Center, Mountain Radiation Oncology Consultants, his address, suite, city, office, fax, and email. I have that for my oncologist, my radiation doctor, and my primary. If you have a chiropractor, if you have an endocrinologist, if you have, you know, a urologist, whatever your situation is, just put them on there. Because then you're not rifling through your purse when they make you fill out all that paperwork. Okay, second section. So doctors, insurance. Same thing. I took my, now I'm on Medicare. I feel old. I have my Medicare card with my member number, the 800 number. If there's any like RX bin numbers, any group numbers, ID numbers, customer service number is huge. Because say for example, at CP, at Canadian Pacific Railroad, the US employees worked technically for the Sioux Railroad, and our insurance provider was Blue Cross and Blue Shield of Minnesota. I'm sure Blue Cross and Blue Shield has like of Colorado, of California, of wherever, but they're all different customer service numbers. The difference is if they're looking at, hey, she's in the hospital and we want to know if we can do a PET scan, or we want to know if we can do something else. I was going to try to show you Frank, so at least you have something fun to look at. In any event, I put the customer service number because they might need to call and just get approval as a provider. So put that on there. So, doctor, insurance, medicine. I put everything that I put into my body. So, like I have my Halavan is first. That's my IV chemo. I don't know the dose. They tell me the dose every week when I get it done. Like you have to give them your name and like they compare bags and they just want to make sure you're getting the right drug and you're the right person. So they tell me it's like 525 or 3, I don't know, whatever. Doesn't matter. They just need to know the drug. I also get pre-meds with my IV drug. So I get Aloxi, which is a anti-nausea medication. I've got on here my Xgeva, which is a stomach bone injection. Again, I don't know the potency of it, but I do have on here, like say Halavan, I put IV chemo. My Aloxi, I put IV anti-nausea pre-meds. For my Xgeva shot, I put it's a monthly shot for bone strength. I think that's what it's for. And then like say for Ambien, I put Ambien CR 6.2 milligrams as needed for sleep, because I want them to understand, like say that one, or I even put supplements, but everything I put like my oxycodone as needed for pain, because I'm not taking it every day. That's kind of as needed for pain. And if they wanted to know, I could tell them, but at least they know what potentially could be in my system. And then I've got, so I have my IV chemos, I've got any prescription medication. I also put down, I take Ritual multivitamins. I take a calcium B12 melt away. I take low dose aspirin, 80 milligrams, Claritin, turmeric, Aleve as needed. And then I have my medical marijuana on there because I would rather more information than less. So doctors, insurance, medicine, and these are only my categories. You can change yours. Health history. Every single form makes you fill out health history. And my problem is, I don't remember. So I spent one day and was like, okay, let's try to think about this and see if we're correct. So I've got everything from like in 96, I had my tonsils taken out. 98, I think, I had my wisdom teeth taken out. And then for me specifically, I'm not going to do every surgery I had. So I kind of lumped everything and put 2007 breast cancer, stage 2B, bilateral mastectomy with lymph node dissection and reconstruction. I put February 2011, I had a C-section, same in 13. December 16, removal of ovaries and tubes. And then for my metastatic cancer, I put like all the spots that I've had cancer. And then in April, I had progression to my right hip, spine, 9 vertebrae, blah, blah, blah. And I even listed out the specific vertebrae. And then I have removal of gallbladder in October 17. And then, so mine kind of ends like this. So then, I don't even know if this is backwards. So then in February 18, I had Mets to my tailbone and my liver, or it's called the coccyx. I think that's funny. But then June 18, we got the NED, which doctors would know means no evidence of disease. So my cancer has not found a place to land. So right now we're kind of the healthiest I'm probably going to be. So pretty in-depth, thorough history, and then followed by kind of allergies and general information. So I put on here latex. I'm allergic to the adhesive on certain like tape bandaging. And I'm also allergic to mushrooms, except for buttons and scallops. Here's the thing. Do they care that I'm allergic to mushrooms? Maybe not. But there are medications that have mushroom in it. So it's extremely important. While you might think that putting down a hay fever allergy might not be super important, it might counteract with a drug. Or they may just want to know because maybe you have a stuffy nose. Who knows? And then this is a section that I just added. Look at that. That's what a bulldog little face looks like. Super close. Okay, turn around. Sit down. Good boy. So the last section I added was my average vitals. So for example, my normal body temp is 97.7. My blood pressure is around 90/60. Resting pulse is 72. I mean, I know you guys don't care about my number specifically, but I then also have height and weight on there. The reason I added them this week is I met this sweet gentleman that was diagnosed with stage 4 prostate, and his entire life he's been a competitive swimmer, and his resting heart rate is in the 40s. Well, he passed out, and they took him by ambulance to the ER. He woke up and they literally had the paddles on him ready to like zap him. Frank's wondering what I'm doing. And they were going to zap him because his heart rate while he was sleeping got down to 38. Well, for him, that's kind of a nightly occurrence. For me, it would be bad. So here they were going to zap him not knowing what his resting heart rate was. So luckily he woke up. I say that just to be, I would rather, if something happened to me and they find this form, they have more information than they need, then less. I can tell you every time I've been in the ER, they love this form because I will literally just hand it to them and say, you can give it back to me whenever. And they'll take it back and they've got everything. So they're not, I'm not having to rifle through my purse, or my friends aren't having to rifle through my purse. But I've been to the ER and they have rifled through my purse to find this information because I've told them I have a list of everything. If nothing else, It's always just good to have if you're in a car accident, if something happens, you have all your information and there's no questions asked. If you want to put an emergency contact on there, probably wouldn't hurt. But I hope everybody could benefit from this. And I think it's something that I have found to be extremely useful, and hopefully you will too. But make it your own. Make it as, if you want to make it crafty, you can do whatever you want. But make one and carry it with you so that there's no questions and there's more education when something happens than question marks. So, I'm not sure what my next topic will be. If anybody has any ideas, let me know. Otherwise, we'll talk to you soon. But thank you for watching. I have just been so touched by everybody's response. So thank you. I appreciate it more than you know. I also want to just throw out there, because I'm super excited, I'm trying to pull off a surprise for my doctor. Nobody tell him. And I already got feedback today. I'm so excited. So that'll be coming. I'll fill you in. But I can't share it because I don't want him, I don't know if he watches these or not. And if he does, I can't ruin it because it's so good. Okay, love you all. Have a good night.